Hi, my name is Dr. Karen Wolfsdorf. I'm a theriogenologist at Haggard Equine Medical Institute, and I'm going to discuss a little bit about body condition in both mares and stallions. And we're going to focus a little bit more on the older animal, that being 15 years or more. And why is this important? Is because mares have a specific function even when they're over 15, and that would be that we would like to be able to breed them and have babies from them. And the stallions the same. We have a lot of older stallions that are still breeding and still needing to be able to perform the reproductive acts to make babies. So what does this mean? Well, when I look at a horse, I like to be able to feel their ribs, but not see their ribs. So I look at it a little differently. I don't say, okay, this mare is a 1, a 5, a 4. I look at it for each individual horse in that I don't want a lot of covering on the ribs, but I want to be able to feel them, and I don't want to see them. And in my mind, that is too thin. If we can see ribs, it's too thin. If we have an inch of fat over the ribs and I can't feel them, that is too fat. Why is it important? Well, especially with the reproductive cycle, it depends a lot on the body conditions. So if a mare is too thin or a mare is too fat, they're going to cycle irregularly. When it comes to the beginning of a breeding season, I would much rather have a mare be on an upward plane of nutrition, so slightly on the thinner side, and then you can feed them during the winter as they start cycling, versus a mare that is fat because we're worried about her in the winter, that I'm then going to have to get to cycle and get to become pregnant. So we would rather have mares on an upward plane of nutrition being very fat or very thin. Now with the stallion, you have the same thing. Breeding a mare is quite a strenuous and athletic function. And so while we want to have stallions be able to perform the task, we need them to be in good condition. And so that may mean that, again, they need to be fit. What does that mean? We don't want them standing in a stall all the time. We want them to be able to move about. They have to actually get in training to be able to breed the number of times we want them to breed, as well as we want them to not get too thin because they are expending a lot of energy. So again, these horses or these stallions, we want to be able to feel ribs, but not see ribs. And we want to be able to feed them so we recognize what their tasks are and what they need to do on a daily basis. Stallions and mares are going to be individuals again, and what is good for one mare is not good for the other, and the same with stallions. So we have to cater our programs to noticing, oh, that mare's gotten a little thin, maybe I need to increase her feed, or that mare's gotten a little fat, and the same with the stallions. So it's very important to monitor your horses daily so that you can adjust their feeding program so that they're capable and able to do what you need them to do, both, in work as well as reproductively. So one of the things that's very important is to remember that looking after your horse, your older mare, your older stallion is a team effort. One can't go without the other. So you want to be able to work with your veterinarian to make sure that they're not only getting the correct nutrients that they need, the correct body weight, the correct vaccinations, so that they're able to do what you need them to do, especially reproductively. We need those mares to cycle normally. And so they need to be given the appropriate vaccinations so that, one, when they go to the breeding shed or when they are bred, we're not going to have diseases that can potentially affect their early embryonic development or, in fact, cause them to abort. So that's very important to work with your veterinarian. It's very important to look at the mare's perineal conformation or her reproductive tract in order to make sure that you're doing everything that you can so that that mare does not suck air or have an infection so that she's able to get pregnant too. And we'll talk a little bit about that in a minute. The other thing that you want to do is work with your farrier, because lame, sore, footed mares lame mares, anything that causes inflammation can affect the mare reproductively too. So the whole body works together to be able to get pregnant, maintain that pregnancy, and have a baby that's normal and healthy. When we're dealing with mares for their reproductive well-being, as well as if we want to get a mare in foal and have a baby, there are certain things that we need to remember. The first thing is that we have to remember that the mare's reproductive cycle is about 21 days. They are long day breeders, so that they start to cycle as the daylight gets longer and the nighttime gets shorter. What this does is it releases the inhibition of melatonin on the hypothalamus in the brain. So it allows the cascade of hormones to start to function again as the day length increases. So that is a time that you're going to start seeing mares have variable heat periods. They may seem like they're in heat all the time. They may seem like they're never in heat. And what that is that they're going through this transition period. And the transition period is about a 60-day period in which they'll grow follicles and they'll regress follicles and they'll grow follicles. And then what happens is that one follicle produces enough estrogen so that the mare will come into a proper heat. That estrogen will relay back to the pituitary, and the pituitary will release luteinizing hormone, which then causes the mare to ovulate. Once you have an ovulation, that is the beginning of the mare's cyclicity. And that is the period in which you can breed this mare and potentially get her to ovulate and get pregnant. Okay, so it's really important to remember those key factors. The other thing that's really important is that you have to remember that what the reproductive tract of the mare looks like. And so you have two ovaries that are hanging right around the flanks of the mare, and then they're connected by the oviducts to the uterus, which has two horns that come together, and then to the body. And then that body of the uterus is connected to the cervix. Then the cervix is connected to the vagina, the vestibule, and the vulvar lips. And the vulvar lips are one of the most important parts for you to evaluate, I think, when you are looking at a mare to breed. And why is that? That is because there are three areas that are kind of the gateway to a mare's uterus. Okay? The first one is the vulva lips. The second one is the vestibular vaginal fold, which is kind of the hymen area. And then the third one is the cervix. And if any of those areas have a defect or are not able to function properly, what happens is that the mare contaminates herself with feces or with air, and then bacteria can enter into the uterus, and then she becomes dirty or has endometritis or inflammation of her uterus. And when you have that, it is very difficult for a mare to get pregnant, because we want the ideal environment for an embryo to develop and grow. So to look at the perineal conformation, what you're looking at is you're looking at the rectum with the vulva lips below it. And what you want is the rectum or the anus and the vulva lips in line with each other. So they should be basically vertical to the ground and on top of each other. As a mare ages, okay, and she has foals, her reproductive tract will become baggy and saggy, unfortunately, just like all of us. And so what happens is that everything stretches. And so the uterus and the ovaries that were sitting high up in the flank and high up in the abdomen now go down and are sitting towards the lower part of the abdomen. And what happens to the vulvar conformation is it goes from this to basically this, in which the anus is now here and the opening to the vulva is here. And so now you can see that when the mare goes ahead and defecates, she can defecate into the opening of the vulva lips, and that's how the mare gets contaminated. So there are different things that we can do to try and help that mare's perineal conformation. We can do a Kaslik procedure in which we suture it down. We can also do different procedures to try and straighten everything up. But it's really important to recognize that that is a problem and discuss with your veterinarian what is the best way to combat that so that we can get your mare ready to be productively sound, so to speak. Okay. You also have to remember that the baggy sagginess occurs to the uterus too. And when a mare is in heat and gets bred, she needs to be able to contract her uterus and push the contents out of the vulva lips. And that's very important, again, to provide a conducive environment for embryonic growth. And so we can use different hormones, different compounds, different procedures in which to help that mare regain the contractility of the uterus and to help with gravity and getting the contents that we need out of the uterus so that we provide a conducive environment.